Okay, so let's talk about tracheobronchial tears. We have the trachea, which is important for breathing. You breathe throughout your trachea to the bronchus. You have the trachea, carina, right bronchus, left bronchus, segmental bronchus, lower bronchus, and everything. So, or maybe lower and then segmental, but anyway, this is the airway. And you have your esophagus. And we are talking about the trachea and the bronchus. So we are talking about the airways. And there we are talking about tears. So tracheobronchial tear is tears in the trachea or more inferiorly to the bronchus. Right main bronchus, left main bronchus, to the bronchi. So those tears have high mortality. So it's very important that you will understand them and identify those tears. What should you do when you identify those tears is bronchoscopy, early bronchoscopy, to avoid delayed bronchostenosis. Because if you miss, you may get bronchostenosis. So when you're talking about tracheobronchial tears, there may be two presentations. It can be tear in the right main stem and distal left bronchus. And how it will present is as pneumothorax that is quite weird. It's a pneumothorax that you put a chest tube, you drain the pneumothorax, but it's not working. It's not relieved by chest tubing. There is a tear, and this tear just doesn't let the pneumothorax to get resolved. So this presentation of unresolved pneumothorax may hint for a tear in the tracheobronchial area, or more specifically, right main stem and distal left bronchus. And most common location for this is the right main bronchi, 2 centimeters from the carina is the most common place for this type of tear, unresolved pneumothorax. This is your hint. Now, the second presentation from tracheobronchial tear is tear of the trachea and left main bronchus. When this happens, what you will see is air that is usually in the mediastinum and subcutaneous tissue, like emphysema of the subcutaneous tissue. You may hear crepitations if it caused a subcutaneous tissue. So this is the second type. So again, tracheobronchial tears are very important to identify. Very high mortality rate, about 30% mortality rate. You need early bronchoscopy to detect and to avoid later bronchostenosis. Two presentations can be for those tears. One is unresolved pneumothorax, and the second is air in the mediastinum and the subcutaneous tissues. So importantly, don't miss the tracheobronchial tears. Think about them. Unresolved pneumothorax, subcutaneous tissue, think about them. And think about the bronchoscopy that you should do and the complications that may arise later if it's not treated. Thank you very much, and that's it.